Morning sunlight filtered through the glass walls of Singapore Hospital, casting a gentle glow over the crowded foyer. Nurse Mei Ling adjusted her mask and prepared for another busy shift. The hospital bustled, rows of patients waiting their turn. Beneath the clinical surface, Mei Ling saw traces of invisible wounds: fear, uncertainty, shame. Here, trauma was not rare. It was woven into stories of car accidents, illness, abuse, displacement. Mei Ling and her colleagues knew this truth well, and they embraced trauma-informed care as guiding practice. The day began with Mrs. Tan, an elderly patient recovering from a fall. She'd grown withdrawn since her arrival. Her daughter, anxious and tight-lipped, explained in hushed tones that her mother had survived domestic violence decades ago. Mei Ling listened carefully, not just to the words, but to the tremors behind them. She nodded gently, avoiding rushed questions or sudden movements, conscious that hospital routines might remind Mrs. Tan of past powerlessness. In the ward, Mei Ling made it a priority to explain every step. "Mrs. Tan, I'm going to check your vitals. Is that all right?" By granting her patient autonomy, Mei Ling fostered trust, letting healing begin with respect rather than pressure. She learned that trauma came in many forms: a harsh word, a shaming glance. And in Asian societies, such experiences were often unspoken, shielded by silence. Later, a young man named Ravi arrived after a workplace injury. He flinched when spoken to suddenly and had trouble making eye contact. Mei Ling recognized signs of trauma, perhaps rooted in childhood or recent events. She created a quieter corner for Ravi, away from the noisy corridor, and gave him time to answer questions. Mei Ling understood that culture and stigma complicated trauma in Singapore, so she did not pry. Instead, she made space for dignity and gentle engagement. On the break room whiteboard, staff wrote reminders: care starts with safety, not assumptions. Mei Ling saw her teammates struggling too. One nurse confided about burnout, haunted by memories of the pandemic's endless chaos. TIC guidelines encourage staff to check in with each other. They shared tea, laughter, and moments of vulnerability. When trauma touched staff, leaders responded with open-door policy, flexible shifts, and workshops on self-care. The hospital's approach was not perfect. Mei Ling noticed gaps, language barriers, hurried consults, but small changes mattered. Curtains drawn for privacy, soft voices, concise explanations. She recalled a nurse from Malaysia who suggested adding comforting visuals to the pediatric ward, all colorful, gentle patterns to soothe young minds. Change was incremental, shaped by each encounter. In a weekly team meeting, Mei Ling shared a story about Mrs. Tan, emphasizing how trust had unlocked her willingness to participate in rehabilitation. Her colleagues reflected. Singapore's multicultural mosaic meant trauma could reflect traditions, family histories, systemic discrimination.